Hello, I'm Claire Fuller. I'm a GP and I'm the Chief Executive of Surrey Heartlands ICS, and I've been a Surrey resident since I was 3. So the things that you hear about here, they matter to me because the care that we deliver as Surrey Heartlands Integrated Care System is the care that my family and my friends receive. And so that means that the things we are going to do are going to be good enough for my family and friends. And if it isn't, I'm going to hear about it. And that's why I think so many people in this room are local. And that's why we stand such a good chance of succeeding. Now, I will talk just very briefly about, that's it, that's the slide. So Giselle wanted to talk to me to talk a little bit about the system pressures. You will see on this, it is comparative numbers of appointments and contacts that have happened over the last year. There is not one part of health and care that is doing less activity than it did this time last year. Demand is rising. And what rising demand means is it has impact on 2 things. The first thing is access. So it means it's harder to be seen or that we have to wait longer to be seen. And as a consequence of that impact on access, it means actually that we get a loss of continuity. And now sometimes that matters and sometimes it doesn't. I personally would say I think it always matters. You do better if you are seen by somebody that knows you and has access to your records and you are seen in a setting that works for you. However, my children would say, I don't care who I see, I just want to be seen now and I want to fix very quickly. But because the demand is going up and because the number of people we have available to work is going down in many areas, we need to organise ourselves in a different way. And that's what the Fuller Stocktake that Ian very generously was talking about is all about. It is about how we organise ourselves in a way so that it works for the people that live in Surrey, the people that live in England, rather than organise ourselves in a way that works for different sectors or for different organisations. So in the Stocktake, we talk about how we deliver integrated urgent care. So that's how you get your appointment on the day, how you get seen. And I'm going to heavily trail the very fabulous Pramit Patel, who's sitting in the front row, is doing the workshop later on, which will go into more detail. And there are the 3 areas to look at: integrated urgent care, how we look after our most chronic and complex and complicated people who need continuity more than anybody else. And that may be about frailty, it may be about long-term conditions, it may be about mental health issues, it may just be about a vulnerability of lifestyle, it may be some of our most complex children will fall into those categories. And thirdly, it's about prevention. And I see Gillian sitting up here, who was featured in the video. At the moment, as an NHS, we spend our time, we're mopping the floor, and we've got to turn that tap down, if not off, because we will never have enough people or enough money, and it is not the right way to be delivering care. So the Stocktake talks about access, about how we look after our most vulnerable people, and about how we better do prevention. But to do that, we need an environment change. And in the video, which I did love, Giselle, thank you. Giselle was worried because I hadn't seen it, but I did love it. That we talk about how we better use our estates, not just the NHS estate, the one public estate and also commercial estate. How we better do data and digital, how we have a single record that we can all access as people, not just as professionals. You know, I want to be able to make my own appointment and change it and cancel it. I don't want to have to hang on a phone and wait for ages. Oh, I'm getting the sign right. And the third thing we need to do is look after our workforce. And we've got another workshop this afternoon, which Michael Pantlin will be leading on our United Talent Strategies. So thank you all very much for coming.